He works in behavioral health. He does a lot of stuff with the federal government. He's an amazing man. But he started a hashtag called Occupy Healthcare. Okay?
Yep.
And I love that hashtag. And I truly believe in Occupy Healthcare because that's what I do. See, painting on the back of business suits that go to medical conferences is totally Occupy Healthcare. You know, it's like take the space, own the space, change the space, right? And that's what we are doing right here today. So how can an outsider artist send a message to us all? They can write it on a wall. So a lot of people, before the modern era, before the true instigation of street art, right? It was graffiti, and it was in place, and it was in a one time and in one space, and it was covered up. Like if a graffiti artist wrote on a wall and the town saw it, probably within days or maybe weeks, it's gone. And it was gone forever. Unless somebody happened to take a photo and it happened to go in a book, or it happened to be shared among friends, or maybe win a photograph album. And then everything changed. That which was ephemeral and only in the moment became forever. So when you start doing street art and you start doing murals and you start putting it on the wall, it doesn't stay in a physical place. It spreads throughout the universe. And it becomes a conversation in any country around the world, and it changes things. And paintings are powerful visual metaphors that get people to understand what it is to be in this situation. So I painted a mural in Washington, D.C. in 2009, and I painted that mural because my husband was hospitalized for 11 weeks in 5 facilities, and during that time, we could not get timely access to his medical record. The first facility said it would take 21 days and 73 cents per page to get to his medical record. The second facility, we managed to get in there, and they sent me back to the first facility to get his entire medical record because he was transferred with an incomplete and out-of-date medical record and transfer summary. It was 2 weeks old. That meant once he got to a new facility, they could provide no adequate care because they had no idea what was wrong with him other than a blanket idea that he had kidney cancer. So using a phone and a fax machine, they tried to recreate his medical record in 6 hours. Of course it was unsuccessful. They got enough information together to get him back on his meds. He was transferred with a lidocaine patch that was not marked, a fentanyl patch that was not marked. They had no idea what was the level of drugs within his body. So those doctors came to me the next day and said, we're sending you back to the first facility to get his medical record. And I laughed in their faces because I'd been trying for, at that point, 4 weeks to get that medical record. I said, they're not going to give it to me. I keep trying. They will not give it to me. They said, they're going to give it to you this time because we're sending you as a courier. You're getting it for us. The old hospital printed out the medical record in an hour and a half for a courier. And I gave it to the doctors, and they read it. And they read it in about an hour. Okay, now this document is about this thick, okay? I was like, you read that? We read the most pertinent things, the things we needed to know to care for your husband. And now we're giving it to you. Like, what? Wait a second. This is really important information. You're giving it to me. They said, well, yes, because there's nowhere to put it in our system. So if we give it to you, you are going to make sure your husband has the best care. You're going to be his continuity of care. And you're going to take him to facility after facility in this journey, and it's all going to be on you. And I read that record in 3.5 hours. And it took me about 6 hours to organize it. And I was furious because it was full of actionable data that had not been acted on and medical error. Now, I understand medical error. We all make mistakes. But actionable data that nobody's doing anything about, that made me furious. The most glaring instance was when he was admitted, he had a test, an MRI, and that said within the test results, my husband had a distended bladder. That was 325. And on the test results of 326 and 327 and 328, it all stated patient has distended bladder. On the nurse's progress notes of 4.3, it stated concern that patient is retaining urine. And finally, on the radiology report of 4.10, 2 weeks after being hospitalized, it states patient has dangerously distended bladder. And that's the day I learned about it because at that facility, they did radiation off-site. So that off-site radiologist came up to me and literally shook me and said, Mrs. Holliday, I've tried to talk to your doctor. I've tried to talk to the hospital. Nobody is returning my calls. When you get back to that hospital, you need to make sure they place a catheter in your husband. He has a dangerously distended bladder to the point of rupture. But, more importantly, it's messing up my imaging results. So, I get back to the hospital. I go to the nurse's station. I say he needs a catheter placed. But he has a pre-existing condition. It's called a urinary tract stricture. He's had catheter placed twice in his life. He needed a urologist both times. You're going to need to get a urologist to place catheter on my husband. And the nurse's station said, we will try anyway. They tried with a 16 gauge and were unsuccessful. They tried with a 12 gauge and were unsuccessful. And then gave up, finally called the urologist. He came 24 hours later and placed catheter. The progress notes for that day state, patient refused treatment. I was furious when I read all this stuff. So what I thought and prayed about was, how can I change this so other people do not suffer as my husband has suffered? I thought, it's data transparency. If I could have seen this information as it was coming out in real time, at least on a daily basis, my husband would have gotten better care. So what I began doing is painting a really large mural in Washington, D.C. that was about my husband's journey. But I didn't stop there. I tweeted, I blogged, I Facebooked. I started attending free public federal meetings. And this is really important for all of you to know. There are federal meetings you can attend, there are state meetings you can attend, there are local meetings you can attend, and you can change policy. Because there's this amazing point in most meetings where they say, are there any questions from the floor? And when that is asked, you run up to that microphone. Because your voice is valuable, and you may not be on that stage, but you are in that audience, and those questions can change things. The mural that I did got picked up by national and international press. It became part of two pieces of legislation, the high-tech legislation toward meaningful use and the Affordable Care Act. Why I was supporting both pieces was, in part, you cannot get adequate care if you do not have access to some kind of insurance system or government aid system. You will be only seen at clinics, there will be no continuity in your medical record, and they will not find patterns of growth that could show things like cancer. So we need to have equal access to medical care. Once we have that access, we need equal access to electronic information about our care, because access to the provider is not sufficient. In this day and age, we need to be empowered patients and empowered caregivers who read that information and make choices based on it. After I painted that, I was trying to figure out what are the next steps. What should I be doing after the mural? You know, not a whole bunch of free blank walls are available, okay? So I started painting on canvases. And one of the canvases I painted about was about HCAP scores. So this one is George Washington University Hospital. Their scores were available online. And I entered a competition at this new event that would become Health Datapalooza. The Health Data Consortium was running this brand new event. There wasn't going to be a lot of people there, and they did an open competition about showing what you could do with data sets. And they said, we would love to have techies and programmers and artists and poets. And I was so excited because I'm like, I've been invited! And I turned in a painting to that event. And so I looked at the HCAP scores for that university based on the 2010 data and what they were doing within their medical center, and it was not good. When you looked at their HCAP scores, this is things like, was my pain controlled? Did the doctor always respond to me? Did the nurse respond to me? Was my room clean? Those kind of questions. They were getting C's, D's, and F's based on their patient satisfaction. What was really exciting is where I painted it. See, that university has a major metro entrance in front of it in the hospital. So I set up my easel right across from the metro entrance, right in front of the facility on a public sidewalk. And it became like the internet in real life. I was a data point, and the stream was going past me, and people would click on me all the time. They would basically come up to me and say, what's this? What does it mean? Why are you painting that? And one of the people was even on the board of directors for the hospital. As I was explaining this, she said, how did you get our data? How do you know our HCAP scores? And I said, because it's free, public, available online, and guess what? people are going to start looking at this stuff and make decisions about where they're going to be cared for based on this information. And that's what she walked away with, these giant eyes about the future that she saw in front of her. It was amazing. Didn't stop there. There was a thing called Body Shock the Future. My dear friend Ted introduced me to this one. The concept within the Body Shock the Future was, what can we do that doesn't cost a lot that could rapidly change healthcare? And what I did was, again, make another painting, but this time I was pointing out something else that really bothered me. In hospitals throughout the nation, the bedside tray table that they use to feed you, they also use for incontinent bedding changes. So what I did is I painted a little preschooler with a thermos lunch pail sitting right on top of a toilet. Because, and if you look at the child's face, he's like totally disgusted. Because even a 3 or 4-year-old knows you do not eat off a toilet. Yet in hospitals throughout the country, every single day, we are asking patients to do that very thing. And when I've gone to hospitals and spoken to them about this, every nurse in the room is nodding their head. Yes, we do that, and it is not acceptable. And some people are beginning policies to change this in their hospital. Okay, Partnership for Patients campaign. Sometimes blowing a gasket leads to the kind of collaborative disruption. Okay, so back a few years ago, there was this campaign, it is closed now, called the Partnership for Patients campaign. And the idea was we need to reduce hospital-acquired infections and reduce hospital-acquired conditions and readmission rates. That was the whole concept of the campaign. And they invited all these amazing hospitals and doctors to this federal meeting. Don Berwick was presenting, and a couple of people that were in that room that day were really, really angry because they saw the list, and there was not a single person who self-defined as patient on it. So there were 2 people going to be in that room that contacted me. One was John O'Brien. He was with CMS at the time, and he thought this was really unacceptable. The other was Chuck Denham. He was invited as well and thought this was unacceptable. Between the 2 of them, they got me invited for the next day. The event was going to happen the next day. I said, I'll come, but I'm going to want to paint at it. And they said yes. So I set up my easel in the back of the room, and I began this painting. It was based on their logo, and I did see their logo in Jolene's slide deck. Partnership for Patients. And in Partnership for Patients, the doctor is touching the patient, and the patient literally is doing nothing. They're just a shape, a blob shape, doing nothing. And it was like, oh my goodness, even your logo is not embracing of what we're supposed to be doing. So I was painting, reimagining their logo when Don Berwick saw me. And he's like, you're not on the agenda. I said, no, I'm not. Patients are actually not on the agenda. And so he gave me 7 minutes of his speech that day. And it was beautiful, and some people called it an altar call, and all these people rose up and said, yes, we want to be part of this. We want to spread this. And then for 9 months, no one contacted any major patient leader about any more work on this campaign. And then they finally got a PR firm that was going to handle us. And yeah. And they were going to have a webinar that we were supposed to be able to present with it. Now, who's done a CMS webinar? A few of us? Yeah, okay. PowerPoint, death by PowerPoint, right? Okay, so we were having this webinar. And while we're having this webinar, they're talking at us. And they're talking at us in a way that isn't respecting us. Like, we are a healthcare crowd. We do know what you're talking about, and you don't have to be infantile to us. We can have an equal discussion, and we actually should. We should be speaking as much as you are, because this was supposed to be the call. They had no money to bring us into D.C. There was only going to be a call with us. And about an hour into that call, I got so angry that I couldn't take it anymore. And I burst into the webinar because they didn't mute our lines. And I said, if you were really serious about doing this, if you were really serious about including us, you'd change it to partnership with patients, not for. You would make sure that we found the money to get this together. Now, what I did not know was we didn't just have this small little crew of people who were working on the Partnership for Patients campaign listening to that call, but pretty much most of CMS. So the waves went through the whole federal government that Regina was freaking out on a webinar. And within moments...
And deservedly so!
Within just minutes, Pat Masters and Helen Haskell and myself were all reaching out to each other via direct messaging, DM, Facebook about building our own conference. And that conference was called the Partnership with Patients, or Cinder Blocks 1. And we would crowdfund it. So we managed to raise money using patient travel scholarships and through the Society for Participatory Medicine. We work with Health Tech Hatch. We work with MedStarter. In the end, we raised, $23,000 to run a patient conference in Kansas City. We worked with Cerner, and they gave us the space and the projectors and their tech team to be able to pull this off. They even gave people tours of what was going on within EMR so people would understand better when we go to policy meetings what folks were talking about. And it was absolutely amazing. And we had patients and doctors throughout the nation coming to Kansas City, and we had CMS come to our event. Okay? And if you knew what was happening that year, that was the federal travel shutdown. But we still got someone. So it was beautiful and it was amazing. And you can do this. Don't ever let people tell you that there's no funding for that. We could make funding for that. Hospice cards. So if you go to the card aisle, I love it if everyone in this room would go to the card aisle and ask for their hospice cards and watch what happens with the cashiers. Because in most cases, they're going to have absolutely nothing to show you. We had a tweet chat with TED Med, and they said, what is the most rapid way to change things in end-of-life conversations so we start talking about end-of-life conversations? And I tweeted out, well, Hallmark needs to start making hospice cards. And Hallmark tweeted back. And they said the Gold Crown stores did have appropriate cards for hospice, and here was the link, which I then went to, which I used their search engine and typed in the word hospice, and it came out term not found. And then I went where end of life, and it came up with bat mitzvah cards. Okay? So fail. So I started doing a change.org petition to encourage hospice cards at Hallmark. And they then had to respond publicly because it got picked up once again by national and international press. And what Hallmark came back with was, we do not lead. We are a mirror of society, and we reflect that which our customers like. And I came back, you can be a mirror, but you should be a signal mirror, and you should lead the way. Hallmark has yet to this point create actual hospice cards, but another company called Greeting Card Universe that works with Target did. They created 24 different hospice cards, and they were created by artists that work with them who've all lost someone and knows what this means. This is the walking gallery. Okay, a lot of people in this room are members of the walking gallery, and it is a kind of flash mob, okay? So we do coordinate by email and social media. We do have gatherings around the nation. The closest one to now is going to be June 15th in Washington, D.C. at the Drug Information Association's international meeting. And that's a big deal. This is a huge, huge meeting, and there's a lot of people at it, and they invited us to be there. And they're tweeting about it, and they're excited about it because they understand that the way you reach people is talking to them about their stories. But throughout the year, there are gatherings. And what I do is I message out to everyone when is going to be happening. I love this quote by Shepard Fairey. He's a famous muralist out of California. And he said, the more stickers that are out there, the more important it seems. The more important it seems, the more people want to know what it is, the more they ask each other. It gains real power from perceived power. This is a big deal, okay? HIMSS conference is usually 40,000 attendees. And for the last 3 years, we've had between 25 to 45 members of the Walking Gallery attend a conference of 40,000 people. And with that many people, we have been top 10 in Twitter mentions for the entire conference for 3 years. Wow. That is the power of story and visual combined. Okay, so the Walking Gallery. It got picked up in interest by NPR, by Fox News, yeah, and Marketplace. And when Marketplace started talking to me, I'm like, okay, you're an economic news organization, so what do you have I mean, you do understand the walking gallery, we don't charge for the paintings, right? And they said, that's okay, because what you do affects economic policy on the grand scale. We are affecting the choices that leaders make when it comes to healthcare.
Marketplace is a terrific show.
It is, and it's not in that deck, but we were recently covered in USA Today as well. So, yay, the walking gallery. These are all, I'm not the only person painting at conferences now. There's Lygia Riccardi, she's painting at a conference. Megan Mitchell is painting at a conference. I've painted at a conference called Avatar, and yesterday we were painting with the wonderful team that's here, okay? I don't have to be the only person doing this. I have been to way too many conferences where I talk to people like, wow, I'm so glad you get to stand there in the back of the room. I hurt so bad from sitting in this chair. I wish I could be painting with you. And I'm like, why aren't you? You know? This, I don't have to be the only person do that. We can normalize this. One of my life goals is to be at an HHS meeting inside of the building, not outside, and have a whole row of easels in the back. That kind of integration is the kind of integration we need within healthcare. Let patients speak. So there's been quite a few organizations working on trying to make there's patient inclusion within conferences. The patients included symbol means that a conference has had patients in the design phase, patients are in the audience, and patients are on the stage. And there's some people who boycott conferences that don't have that symbol. There's also the Patient Voice Institute that Pat Masters has been working on since our first Cinderblocks event. She is also trying to create a story database at the same time as create a speaker database. So the word of all of us gets out. One of the people that I spoke about early in our speech is named Chuck Denham. And if you follow patient safety, you know there was a major controversy around that man about a year ago. So he is a member of the Walking Gallery. I think it's really dangerous to ever turn your back completely on anyone. All of us have been harmed in this room. All of us. And the witch hunt that happens for individuals that may be strange or different, maybe do not behave like all of us, I think is wrong. He may have done something wrong. I don't know for sure. But I do not turn my back completely on a friend. They are still part of the gallery no matter what they do, because we embrace all. There is no one who should not be part of our conversation and be part of our mission. At this part of the gallery, at this point in time, we have 357 members and we walk around the world. And we are only getting bigger and stronger.